I love this because there's really nothing on the market that helps with cellulite. No matter, nothing
Just this.
topical.
Yep.
There were injections in the past. We know how that all turned out. And so
Yes.
This is really sort of a game changer. Hi guys, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Smita Ramanathan in New Jersey, and I've got my co-host, Dr. Ashley Amalfi, with me here today up in Rochester. Hi, Ash.
Hi, Smita. Hi, guys. Welcome to Lipstick and Lipo, your little show and tell edition.
Yeah, show and tell. So we've got a good one here for you today because how many times we all worry about the cellulite on our bodies, our thighs, our butt. This is something that every single person is worried about, whether you come in for surgery or you don't. But
yes,
we never really had a good solution for it.
The silent confidence killer. That's what I've heard people call it, and it's like so true because
that's true.
Everything is so good, and like it is that one thing that you can't stop thinking about that's really going to bother you and make you like not feel your best.
Right. And it happens in all sizes too, right? I think
yes.
People generally think if you're overweight or you have a lot of extra fat there, that's when you get cellulitis. But you can get it really, cellulite, you can get it really anywhere at any shape or size. And so typically cellulite occurs when we have the fat and there's fibrous tissue, it's septae that sort of attach the skin to the underlying fascia. And so you get dimpling.
Yep.
And that's really hard to treat with just liposuction alone because those fibrous attachments just sort of stay there or they reconnect and do all these things. And so liposuction will get rid of the volume of the fat and deflate, but it doesn't necessarily get rid of the cellulite itself.
Exactly.
Right?
Yes.
Is that how? Yeah.
Yeah, because those bands, if those bands are just a little tight, then it's pulling that skin down and causing a dimple. And the only way to really fix that is to release the bands with subcision. And so there's a new device that we love, and we hardly ever talk about brand names on here, but I feel like this one we should because it's kind of the only thing on the market that really works. And that's Aveli, which is this subcision device by Aveli Aesthetics that goes under the skin and it really cuts the bands. So this is one we definitely wanted to show and tell because it is really a simple little tool. It looks like a tiny little hook, and it has these little buttons that the surgeon kind of operates. And when I push on that button, I don't have a zoom lens here, but there's a little tiny blade that comes out very safely. So this is just under the skin. You're totally numb for this procedure. And this little tiny hook will be able to hook on your tethered band and pull through and break through that band, and it pops the dimple back up because once that band is cut, then you don't have that deep indent. And it's a really comfortable procedure. We're doing these in the office, so they're adding on to some of the surgical procedures. I know like Smith and I are doing a lot of liposuction with our mommy makeovers. This is something that's getting added on to mommy makeovers, but it's also a simple thing in the office if you want to release the dimples of your butt and thighs. So this is it. It's not very scary looking. It is very comfortable procedure. It's pretty slick the way that it's made and how easy and usable it is for the surgeon. It's a one-time use, so this is only used on you, and then it's a disposable. And that's really it. There's no big setup, so nothing to be scared of. It's an awesome little procedure to add on the office or to do that whole mommy makeover or lower body package and just really smooth out cellulite. But yeah, I mean, we've all seen results online, right, of all these different practices who are using this now. The sides of the thighs are amazing, and you just want to make sure that the cellulite that you're treating is not caused by your skin being loose, but it's truly caused by one of those bands being too tight. And so important to go to a plastic surgeon who can understand and really evaluate if you're a good candidate for this, right?
Yeah, absolutely. I mean, that's at the end of the day, great results happen if you're in the right hands and you're the right candidate. But I love this because there's really nothing on the market that helps with cellulite. No matter, nothing
Just this.
topical.
Yep.
There were injections in the past. We know how that all turned out. And so
Yes.
This is really sort of a game changer.
Absolutely.
So I'm glad that you guys got to see it on
Yes.
this episode of Show and Tell.
Yeah, absolutely. All right. So call your doc. Make sure that your plastic surgeon is doing Aveli treatment for cellulite reduction. And now you've seen it. You have nothing to worry about. Just get excited because you're going to look great in your swimsuit and in your light Lululemon leggings when those legs and thighs are nice and smooth. So, all right, you guys. Well, thank you for tuning in. Stay tuned. We have so much more to come with Show and Tell, and we're excited. Make sure you subscribe, and we will see you next week.
See you. Bye, Ash.
Bye, guys.